just speaking to old friends, so many familiar faces here today, and just fun to be able to be here and to share what God's done in Uganda. And I love Renee's sweatshirt today. It says "in spite of me," because what God's done in Uganda is in spite of me. He put a call in my heart in 2002. I had an opportunity to go to South Africa to work with AIDS babies, abandoned AIDS babies. And I took a baby to a government hospital that was sick, and that was my first time actually seeing a government hospital, and it was eye-opening. And I just couldn't believe that these people had to go through this when they were sick. They didn't even have a baby bottle for a 3-month-old baby at the hospital, and I hadn't brought one. They gave me a little cup to feed the baby with. Anyway, so that kind of, God started stirring in my heart at that time, after seeing the conditions, that He was calling me to do something. I had no idea in 2002 that I was ever going to be a midwife, which actually was my two dreams, to be a midwife and to go to Africa. So God has answered both those dreams. And when I was 57 years old, God opened the door for me to go back to school and become a licensed midwife. So really, my heart is for women and children and babies, but God had a bigger calling. But He didn't tell me that when He called me in 2002. And it's been a journey, been ups and downs. It's sometimes, really joyful, and sometimes it's very heartbreaking. But I agree with Pastor Mark that every life is precious. It doesn't matter if it's here or if it's in Uganda or wherever it is. To see the breath of life come into a newborn, what a privilege that is, to be able to bring new life into the world. So I praise God for allowing me to do that and for calling me. We opened our hospital, our women's hospital. We opened it in 2019. And in 2018, actually, we opened a Calvary Chapel. There we have a Calvary Chapel Mellico. We have over 400 people who have come to the Lord, witch doctors, Muslims. We're in a predominantly Muslim area. We're in a district of 750,000 people with only one government hospital. And so most people, especially in our village where God's placed us, these people had no care at all. So we start open with first the women's hospital, and at that time I didn't know, but everybody was going to start coming to us. So now we serve the whole population, and I'm happy to say day before yesterday, we opened our new inpatient wards. We have now turned the church into a inpatient clinic, or inpatient hospital for men and children. And the church has outgrown that building, so now they have a new building about 5 minutes away from us, and they're building a new church. So it's just exciting to see what God's doing there, in spite of me. I go about 3 times a year. I spend 6 to 8 weeks there. My husband Mike is my biggest supporter, and he comes with me when he can. He's not there as long as I am. About 2 weeks is all he can handle. But he does come, and he does a lot of projects around there. I have my to-do list when he gets there for him to do. And I'd like to open it up for questions, because I'd like to know what questions you may have that I can share with you. So if anybody has any questions, feel free to raise your hand and just ask me. We do about 35 births a month right now, and that's like tripled every year since we've opened in the past 3 years. We see about 125 people a month in our outpatient clinic, maybe even more than that, because we see about 20 people a day in our outpatient clinic. And we now have inpatient. During COVID, we turned the church into a COVID ward. We were able to take care of so many people. We were the only COVID facility in the area, and we had oxygen, and that was a total God thing because nobody in the country had oxygen, but we had it at our facility. God provided like 30 tanks, huge tanks of oxygen for us, and we were able to save a lot of people. And a lot of those that didn't make it, they came to the Lord before they passed, which was just such a neat thing to be able to see and to share in. There was something else I was just going to tell you. Anybody have any questions?
What about staff there?
Staff. We have a staff of 44, ranging from the groundskeepers to our administrator. I have 5 midwives, 5 nurses, 1 doctor who does C-sections, so we have an operating theater, so we're able to do emergency surgeries there, which we do a lot of because women go to the witch doctors or to the traditional birth attendants before they come to us. They don't come to us until they're in trouble, most of them. So we do a fair share of C-sections, but we're able to save so many women and so many babies. In Uganda, the World Health Organization says that 1 in 44 women die in childbirth in Uganda. I know it was more than that in our district. It was probably 1 in 10 before we opened up our facility there. And so it's just been so incredible to be able to see these mothers and these babies survive even when they've been going through such horrific labors. And we've only, in 3 years, we've lost 1 mother, and I think we've lost maybe 3 or 4 babies. We lose a lot of babies because their nutrition is so poor that women deliver early before babies are due. So we have a lot of premature births due to their lack of nutrition during pregnancy. And then another reason we lose moms is because they postpartum hemorrhage, which a $2.50 bottle of Pitocin can save their lives. So when they come to us, we're able to care for them. We probably save, and this is, I'm not exaggerating, 3 children under 5 a week, because malaria is the #1 killer for children in Uganda. And we are the only government recognized blood bank in the whole district. Sometimes the government hospital doesn't even have blood, and they send their people to us. So we're having to care for the government, people from the government as well. But we're able to get blood, and what happens when they get severe malaria, the parents don't bring them to the hospital until they're near death. Hemoglobins are supposed to be like 13, and when these babies come to us, they have hemoglobins of 1 and 2. So that means that they have no oxygen in their blood. So they're struggling to breathe, they're unconscious, and giving them blood and treating them just brings them back to life. And that's something that it's a miracle, really, when you see that. I mean, when you think that 3 babies a week would die, that's a lot of children, and we look at these people and we're not sure what they're really like, but I'll tell you, they are just like us. They love their children. They grieve the same way we do. So being able to be there and to serve these people has been an incredible blessing. Any other questions?
Does malaria stay with you your life? Or is it...
Not the kind that we have in Uganda. It's treatable. So if they would come early enough, it wouldn't get so severe where they needed blood transfusions. But they wait, or they go to the witch doctor first, and then when the witch doctor doesn't cure them, then they come to us. Did you have a question?
How long are you able to follow up on with the babies after birth?
They come back in 6 weeks for a well baby check. We call them on the phone. Most people, even though they're dirt poor and can't afford more than 1 meal a day, most people have phones or somebody in their in their group has the phone. So we do follow up with them a couple of days after they deliver, but they come back in a week, and then they're supposed to keep coming back for well baby checks to make sure the babies are getting enough nutrition.
How often do you go?
I go about, 3 times a year. I'm there February, March, June and July, and October, November. So I'm there a lot. My husband is very generous with me. Any other questions? Well, thank you so much for letting me share this morning. I'm sorry.
What can we do here to help? Is there
Well,
anything
I mean,
we can
my
do?
biggest challenge every month is to meet payroll for 44 staff. That's a big chunk of money, even though they get very little compared to what we do to live on. I think my doctor gets like almost $700 a month. That's the highest paid. And so, but 44 staff is a lot, you know, and taxes and all that. So, and then our supplies, that's about $8,000, a little over $8,000 a month for my staff. And then it's $3,000 to $4,000 for supplies a month. We don't turn anybody away. If we charge very, very little, like 25 cents. But we feel like everything shouldn't be free. They should have a part in it. So we do charge a little bit, and they pay for their medication, but we don't turn anybody away. If they can't afford to pay, we don't turn them away. In the government hospital, if you go there, it's supposed to be free. Government hospitals in Uganda are supposed to be free and free medication. They go there, if they don't have money, because they bribe everybody to get money, so they won't treat them, they'll just turn them away. I was at the government hospital. We had taken somebody there, and there was a woman that had a severely ill child of maybe 4 or 5, and looked like near death, and she was trying to put him on her back and was struggling to get him on her back to carry him. And I went over and asked if I could help her, and helped her get the baby on her back. And then the person I was with came to translate for me. Sorry, my mask's getting dry. And he asked her what was the situation, what was happening. And she said she'd been there for 3 days. Nobody had seen them. And she had no money for food, and she had no money to get home. And this is what it's like for these people in the government hospitals. So we were able to give her some money, so she had transport home and some money for food. And it's just, we have no idea what these people struggle with in a third world country. So, that answer your question? Okay. Thank you so much for letting me share today.